Nearly 1/3 of US nurses who died from COVID-19 are Filipino, even though they make up just 4% of the nursing population nationwide. Among them is Nerissa, a nurse in Los Angeles. This is her story.
When it comes health worker, it's most of them are Filipino. It's like a heritage.
We always taking care of people as much as we can.
It's hard to work if you're not in your own country. But we need to be here for our family, for the people that need our help. I was born and raised in the Philippines, and I was a nurse. I've been working here in Pasadena for more than 6 years. I work most of the time is 7 days a week.
Sometimes I work 24 hours.
Once I get up and be out of my house and go to work, the first thing I'm doing is pray. That's the only sword or shields that, even if I have mask to wash my hands, social distancing, but no matter what, at the end of the day,
my faith. And every day I don't have nobody, aside from pray. How do you call it? This is my headquarters. Especially when I'm too exhausted, I just, no matter what, I need to go to my headquarters and have some coffee for a while just to have air.
I started to work at 7 a.m. I get off usually at 9, but after I get off at 9, I'm on call for a hospice patient if they need some, care or help. It's a lot, there's cancer, there's a dementia, there's Alzheimer. Their health condition is declining. Most of my patients aging like 60 years old to 100. It's more scary. Now, every day, we don't know what's gonna happen, how many patients that it's gonna be, expired in my hand, and how many patients I need to work with. But no matter what, I need to be here for them.
This is only my relaxed time that I can bend and breathe a little bit. I have my, tears. I can't help it because, finally, for how many months, almost a year, we have this vaccine. Hi. Do we have the chai tea latte first? Do we have the chai tea?
We have chai tea.
Okay.
Yeah.
For all of us, this pandemic, it's hard. I have chronic asthma and my family too, so I don't want to bring any of that to my family, but I need to help people as much as I can.
So, how do you call it?
Stopper?
Yeah, stopper. Thank you. Oh, there's no one in here. Most of my coworkers, they quit because we have some outbreak last week, so they're afraid because of the outbreak. But rather than that, most of them are sick also, so that's why I need to cover the shift. I think I'll get this one. I have a lot of friends. They're afraid to say something because to the fact that they need to stay safe, but they still need a job. So what I did is, if I have some extra, like gloves, like PPE gown, if I can share it, I can share it. I have a lot of friends also that they're undocumented. They're working right now. They're the one who in frontliners, but they're afraid to speak. They're afraid to speak, but they're still here. They're still here, and they're not doing nothing wrong. They're not hurting people. They're loving people. They're taking care of people.
They're still working, and they're still surviving, and they still have, we're just keep in touch every day.
It's being emotional to me when I'm telling them we love our country, and we love us being Filipino.
To talk more about this is Ren Capucao, a registered nurse and nurse historian at the University of Virginia. Many people, may not realize that the US and the Philippines have a longstanding history with healthcare workers. Can you just talk about where that all began?
It all begins back to actually the Spanish regime in the Philippines, where they introduced westernized ideas of medicine. But then, it evolves completely by the time the US brings over its ideas of public health, medicine, and nursing. The Philippines was colonized in 1898 after the Spanish-American War. It's pretty close to, I guess, the burgeoning professional workforce of nursing. With the introduction of nursing to the Philippines, we see how this is a way to train indigenous women in proper etiquette, proper Western culture, proper, Americanized ways of life and culture. Colonizing the Philippines is this idea of benevolent assimilation. And, one of those tenets of benevolent assimilation was that at that time, medicine, healthcare, and nursing, like all of these, they were considered like the height of modernization, the height of a modern society. And so as healthcare, becomes a symbol of modernity, American professional nursing is also kind of a burgeoning profession at that time. And so like early on, like people don't realize the mass migration of Filipino nurses, occurs at the mid-century. It's interesting to see how these nurses were integrated into the white healthcare system of the United States. And I think it goes along with the ties of the economic need of having these nurses, because with expansion of hospitals, of course, you need more nurses. And with advancement of sciences, you need trained nurses. You need people that have undergone this American nursing training. And it just so happens, you trained these nurses in the Philippines with an Americanized training, and it works out. It actually works out well for the United States, and that's how I viewed how they fit into the U.S. healthcare system. And even now, there's always been a need for nurses, and when we see the mass migration of these nurses at the mid-century, they're kind of recruited at hospitals where they're needed, So, and a lot of these hospitals are inner city, urban hospitals. A lot of these nurses are working night shifts, the shifts that nurses, don't want, and so forth and so forth. And so we just see kind of these trends continue in different lights, but it's kind of ongoing. And so looking at the pandemic now, with one third of nurse mortality is related to the pandemic, it's not surprising that they comprise one third of these deaths, because historically, the places where they're recruited are high risk, either patient populations or, areas of nursing, it seems.
How did you feel as a nurse when you realized that we were facing a global pandemic?
I guess in my mind, as a nurse, how I feel like I was trained and just my beliefs, it was our job to go to the front lines to care for these patients that are facing COVID. And so whether or not I like it or not, this is what we were trained to do. And, this is how our job is to care for others. And this is where we're needed right now. And that's how I viewed the pandemic in many ways.
Well, this was extremely insightful. Thank you so much for joining us, Ren.